Hello, this is Dr. Grande. Today's question is, what is existential therapy? Now, in order to answer this question, I'm briefly going to cover the existential crisis, because a number of times when individuals seek existential therapy, it's because they are having an existential crisis. Now, an existential crisis doesn't occur the same way for everybody. Some people never experience an existential crisis, and some people would experience multiple crises over the course of their lifetime. An existential crisis is when somebody faces the realities and the mysteries of the human condition in terms of existence and has difficulty coping with that. Concepts like isolation, freedom, responsibility, the inevitability of death, and searching for meaning and purpose in life. Existential therapy, in theory, treats the existential crisis and a number of other concerns, usually concerns that have philosophical underpinnings similar to an existential crisis. Existential therapy is informed by existential philosophy, but the two are not the same thing. Existential therapy is a therapeutic modality used to treat different concerns about existence and meaning and purpose, as well as mental health concerns and mental health symptoms. Existential therapy is an honest and direct therapy. It is appropriate for individuals from diverse backgrounds, and it discusses a subject matter that's difficult for individuals to discuss with friends or family. The meaning of life, the inevitability of death, isolation. These are kind of heavy topics and philosophical topics for everyday discussions. So it allows clients to have a safe place to discuss these really important concerns. Existential therapy is not without its critics, and I've heard a number of criticisms of existential therapy, and I think some are reasonable and some I don't think really hit the mark too well. But one of the common ones is that existential therapy is depressing, that the therapy itself inherently can lead to depressive feelings. I think that these topics, existential topics, are going to come up in therapy one way or the other. I don't think existential therapy brings them out in any really different way than other therapeutic modalities might. It's more centered on bringing them out, but they're going to come up either way. And if somebody's having an existential crisis, they have to have some way to talk about those thoughts and feelings and values. I think it is fair to say that the topic, the existential concerns themselves, can be a little depressing sometimes. But overall, I think existential therapy has a positive feel to it. It's humanistic and positive. The outcome's not supposed to be something that brings people down. Really, though, it's up to the person, right? They have to work on their values and their goals and define their own meaning and purpose in life. An existential therapist can help them do that. So I think of the result as usually uplifting and working out well. Of course, sometimes it won't be. So this particular criticism I really don't believe is fair. The next criticism, however, does have, I think, a little more merit, and that's the criticism that existential therapy really doesn't have any techniques. And to build on that, another criticism is it doesn't have any standard format. So if you go in to receive existential therapy, whoever's performing that existential therapy, that therapist, that clinician, doesn't really have a standard format to use to deliver that treatment. I think this is a fair criticism. We don't really see any techniques in existential therapy. It's more of a philosophical discussion that's housed within therapeutic values, the values of whatever profession are being used: counseling, social work, marriage and family therapy, psychology. So it is fair to say that it doesn't have techniques. That doesn't mean that it's a bad therapy or a poor modality, but there is no standard format and there are really no techniques like we see, for example, in cognitive behavioral therapy, where there are a lot of techniques. Another criticism I hear is that this modality is only for philosophers. Certainly, if someone has an interest in philosophy, this therapy might resonate a little more with them, but I think it's appropriate for individuals regardless of their interest in philosophy or their aptitude to learn philosophy. There are those that make the argument that existential therapy doesn't work well alone. And to build on that, doesn't really treat specific symptoms. This is, I think, a fair criticism. Usually we see existential therapy integrated with other therapeutic modalities. And if someone came in specifically with a particular disorder or multiple disorders, it's hard to see how existential therapy really targets specific psychopathology. For example, ADHD, PTSD, OCD, generalized anxiety disorder, substance use disorders. There's an existential part, I suppose, to all of those disorders. But the main features, we believe, of course, would be genetic and environmental, not philosophical necessarily. So you could see how existential therapy could help with a number of disorders, including some of those, but it's not really a main modality to be used with those symptoms and those disorders. That's the argument. And I think that is fair. I think that existential therapy does work better in terms of treating psychopathology when it's integrated with other therapeutic modalities. The last criticism I hear a lot regarding existential therapy is that it's really just person-centered therapy where philosophy is discussed, and therefore it's unnecessary. So it's an interesting idea, but it doesn't need to be a separate modality. I can appreciate this argument. I think that person-centered therapy is highly non-directive, and existential therapy wouldn't necessarily be, but we do think of it as mostly non-directive. I think it is necessary. I'm not sure it's fair to say it's unnecessary, but I can see that argument. If a person-centered therapist or a cognitive behavioral therapist or any number of other therapists trained in different modalities wanted to discuss existential topics, or if a client wanted to, I think that a therapist would be able to play a part in that discussion even without being trained necessarily in existential therapy. It would be helpful, but I guess it wouldn't be necessary technically. These topics are universal, so a therapist would have a general awareness of existence and meaning and purpose and freedom and responsibility anyway. So I think this argument really reduces existential therapy to just an area that a therapist would study in preparation to deal with existential concerns. So I can appreciate the criticisms of existential therapy, and as I mentioned, some seem reasonable. I think it is important that it's a separate modality. I think it does require individual specific study to learn it, even though the concepts are universal. I think it's helpful. If someone doesn't learn about existential therapy and tries to help people with existential concerns, I feel like that therapist would be at a little bit of a disadvantage. So I find it to be an important modality and one that integrates well with a lot of other popular modalities like psychodynamic and cognitive behavioral therapy. I hope you found this description of existential therapy and the existential crisis to be interesting. Thanks for watching.